Hi, welcome to the 16th episode of 39A podcast. This is Shruthi and I work as a mitigation investigator with Project 39A. Project 39A is an organization that conducts interdisciplinary research on a range of issues dealing with the criminal justice system. In today's episode, we are in conversation with Professor Marc Tassé, who is a professor in the Department of Psychology and in the Department of Psychiatry and Behavioral Health at the Ohio State University. He's also the director of the Ohio State Nisonger Center, a university center for excellence in developmental disabilities. Professor Tassé's clinical interests include the diagnosis of intellectual disability, the assessment and treatment of behavioral problem and psychiatric disorders in individuals with intellectual disability and Autism Spectrum Disorder. He has also been involved in forensic work around the determination of intellectual disability in capital cases. Thank you, Professor Tassé, for joining us today.
Thank you for having me.
So I want to start the podcast with understanding what intellectual disability is, are there different categories, and how is it diagnosed?
So intellectual disability is considered a developmental condition. And what that means is essentially it is a condition that originates either before birth, during birth as a result of some sort of insult, or originates soon after birth during the developmental period. It is generally diagnosed during childhood and consists essentially of three diagnostic elements that are evaluated by the clinician in making a determination of intellectual disability. Those three criteria include the presence of significant deficits in intellectual functioning. The second criteria, which must also be present, includes the presence of significant deficits in adaptive functioning or in everyday skills that include things such as social skills, understanding social rules, interpersonal skills, also practical skills, which are everyday self-care, personal hygiene, but also taking care of one's home, apartment, employment skills or work skills. And then the third aspect of adaptive functioning relates to what we call conceptual skills, which are functional reading, writing, being able to manage time, money, and things like that. Those two elements, significant deficits in intellectual functioning, significant deficits in adaptive functioning, must originate during that developmental period to meet the diagnostic criteria, what we define as intellectual disability.
Right.
So there are historically there have been categorization of people who have intellectual disability into severity levels. But first, it's important to realize that to have intellectual disability in of itself is a significant disabling condition. So I say that because sometimes people think that because you have mild intellectual disability, that you are not disabled, or it's not an important condition, or it's not a severe condition. You really need to think of, the analogy I like to give to people is it's like cancer. When you have cancer and it's a serious disease, it's a serious condition that is very scary and can lead to significant changes in one's life. And now there are certain types of cancers that we may think of as better than others, but still it's a very scary and a very important disease. Intellectual disability is broken up mainly for categorizing or understanding the severity level into four conditions or four levels: mild, moderate, severe, and profound. And those levels of severity are based on the person's the level or intensity of their deficits of functioning around adaptive functioning and intellectual functioning.
Right. Thank you for that, Professor Tassé. That was really useful. So you have been very closely involved in guiding us on the chapter on intellectual disability that is part of the Deathworthy report on mental health and the death penalty published by Project 39A. As a part of this study, we interviewed 88 prisoners on death row across 5 states in India. And the findings of this report revealed that nearly 11% of prisoners we interviewed were diagnosed with intellectual disability, and over 75% were found to have deficits in intellectual functioning. What do you think these startling figures indicate about intellectual disability and the death penalty?
Let me first start by saying the prevalence of intellectual disability in the general population, and that's also true in India. The prevalence being the number of people who have this condition. If we were able to go out and count every person and assess them for intellectual disability, is about 2 to 3% of the whole population. Now, when this project reported a prevalence of about 11% of prisoners, that is, of course, much higher percentage of people in prisons with the condition of intellectual disability than we would see in the general population. Because we have similar rates in the United States and in European countries where we have a much higher percentage of people in prisons with intellectual disability than we do in the general population. And that does not mean that people with intellectual disability are more criminally inclined. What it means and what we've come to understand is that people with intellectual disability who may come to commit a crime, which it does happen, are more likely to be caught, arrested, and put in prison. They are less able, because of their disability, to put forth a good defense or help their lawyer put forth a good defense because of their cognitive and intellectual limitations. And also, we know that people with intellectual disability, even if they may not have committed a crime, are more likely to make a false confession, to be influenced or intimidated into admitting to things that they may not have done and then are falsely imprisoned. And so those are factors that explain this higher percentage. But again, the percentage of about 11% is consistent with the rates of incarceration in the US and in the United Kingdom and in other countries when we assess for intellectual disability.
So currently in India, there is no jurisprudence on intellectual disability. And this is why I think the Atkins versus Virginia decision by the US Supreme Court, finding that the execution of persons with what was then known as mental retardation violated the 8th Amendment to the US Constitution, becomes very important. Could you take us through the historical evolution of the jurisprudence on intellectual disability in the US, and why is it important that intellectual disability be a precluding factor and not a mitigating factor?
Well, so, it is interesting. So that in all criminal offenses, or in most criminal offenses in the United States, intellectual disability is a mitigating factor, is considered to be a mitigating factor for a defendant because of the severity of the disability, because often of what that disability comes with, which is, a greater vulnerability to be influenced by others, a greater vulnerability to making poor decisions, being unable to problem solve or correctly work out complex social situations, which then leads people to committing regrettable actions. In the case of the death penalty, not only has it been considered like a mitigating factor, but it's been considered an exclusionary factor to the most severe punishment that we have for a crime, which is the death penalty. And in the United States, the death penalty has always been predicated on the punishment where we punish the most severe criminals and the most severe crimes. However, when the Supreme Court took up this question of execution of people with intellectual disability, The Supreme Court ruled that because of this disabling condition, because of this limited intellectual ability, because of these poor adaptive skills, people with intellectual disability are really deemed to be less culpable than the average criminal. They are more likely to be, because of the intellectual disability, and it's not because they don't understand by de facto right from wrong. Many people with intellectual disability do understand right from wrong, but because the disability may lead them to being more vulnerable to making poor decisions, not having ability to really modify their behavior based on the potential consequences, really makes capital punishment, death penalty, really an unusually cruel punishment for these people because of that disability. So the Supreme Court ruled in 2002 that people with intellectual disability needed this extra protection, and even if they are found to be guilty of a capital offense, they should not be given the most severe punishment, which is death penalty. And if I may add, since this Atkins versus Virginia case in 2002, we've had two other decisions from the United States Supreme Court around this question of death penalty of people with intellectual disability. And in 2014, there was a case brought up to the Supreme Court called Hall versus Florida, where the state of Florida was refusing to examine evidence of someone's claim of having intellectual disability if the results of a standardized IQ test were above a certain cutoff score. And so the state would apply this very bright line cutoff score to the results on a standardized test of intelligence as precluding their proof that they had significant deficits in intellectual functioning. And the Supreme Court in the Hall versus Florida decision was quite clear in stating that states, although states in the United States define intellectual disability, they must define it in conjunction or tethered to the national medical consensus of intellectual disability. And in the national consensus at that time and today, tests are always interpreted within their band of measurement error. And so tests are not infallible, and they may have measurement error. And so when clinicians and the courts are interpreting test results, they need to be cognizant of what we call standard error measurement. And there may be instances where somebody may have an IQ score of 72 or 73, even if the approximate cutoff is 70. So somebody may have a score that's slightly above that, but still meet the diagnostic criteria because other information, the interpretation of these results and the evidence around adaptive functioning and those deficits and the determination of age of onset lead to a diagnosis of intellectual disability. So it was an important decision in Hall versus Florida where the court stipulated that intellectual disability is a condition. It's not a score. It's not a number on a test. And that's important finding. And then the third Supreme Court decision around this question of intellectual disability and the death penalty was in Moore versus Texas in 2017, where the state of Texas was using a set of criteria that they had developed to against which they measured claims of intellectual disability. These criteria included really skills or abilities that were based on misconceptions of what a person with intellectual disability can and cannot do. For example, a person would not be found to have intellectual disability if they showed to have some leadership skills, which is a misconception. Or in these Florida cases, one of their other criteria was if the family didn't think of this person as having intellectual disability, then that played into these factors. So the Supreme Court struck down these criteria that the state was using as essentially lay people misconceptions, and again reiterated the importance that states follow national medical consensus on diagnosing intellectual disability. And I'll say that these misconceptions that the state of Texas was using were actually predicated on a fictional book of mice and men. And the state of Texas would say, well, if somebody is as retarded, which was the term they would use, as Lenny, which was a fictional character in a fictional book, then the person should be exempt of the death penalty. And of course, the Supreme Court struck that down and reiterated the importance of defining and diagnosing intellectual disability according to the national medical consensus.
Thank you for pointing out those layperson misconceptions, Professor Tassé. I think it's very important, especially in our context where there is a lack of awareness within the legal community about intellectual disability, and it's often confused with mental illness. So could you tell us about the difference between intellectual disability and mental illness, and what is the correlation between the two?
So that's these are really important questions. And these are debates that happen not only in India, but in the United States and in Canada and in Europe. And it's important to realize, and it's important to remember, that intellectual disability, in the vast majority of cases, and I'm going to say 90% of cases, intellectual disability is not discernible by looking at a person or talking to a person. There are no physiologic or physical dysmorphic features. So there are no facial features. There's no physical appearance. There's no pattern of speech that distinguishes a person with intellectual disability from a person without intellectual disability. Now, there's a number of cases, which is a small percentage, less than 10%, that intellectual disability is due to a genetic condition, an organic condition like Down syndrome or Fragile X. And when we talk about death penalty and intellectual disability, we're not talking about those individuals. We're talking about people who have much milder forms of intellectual disability, and again, who don't look any different when you look at them in a courtroom or in the community than anybody else. So intellectual disability and mental illness are often confused, and that's because these conditions are all found in the same diagnostic manuals that we have. The World Health Organization publishes the International Classification of Diseases, in which we find mental illnesses and intellectual disability, because these are the books that medical professionals and healthcare professionals use to identify these conditions and to diagnose them. And it's the same thing in the United States. We use the Diagnostic and Statistical Manual, which has about 350 conditions, which includes different mental illnesses and also includes intellectual disability. But they are very distinct and very different. So let me start by saying intellectual disability is really a condition of what we used to think of as, we used to call it mental retardation. So of delay or retardation of the brain functioning and the brain development. And it also implies a certain arrest, but it doesn't mean that people with intellectual disability cannot learn. They can learn. But really, the condition of intellectual disability is something that is diagnosed in very young age and is a lifelong condition. So there's no medication, there's no treatment to cure intellectual disability. Mental illness is very different. Mental illness is a large umbrella that includes many conditions, such as depression, anxiety, phobia, schizophrenia. But these conditions can occur at any point in time in one's life and can be more episodic or can be more transitory. Many of them, most of them are not lifelong. Many of them today can be well treated, well regulated with medications, and can help the person lead to a very productive and successful life. Again, intellectual disability cannot be treated with medication. And intellectual disability really impacts the person's thinking, their ability to learn, but doesn't affect their mood or their emotion, their concept of reality, whereas mental illness can, in many instances, affect emotions, mood, thinking process, perception, and of course their behavior. What is the correlation between intellectual disability and mental illness? And let me just add that intellectual disability is not a protective factor against mental illness. So a person who has intellectual disability can also have a mental illness. And in fact, we know from all our research that because of intellectual disability, because of the disabling condition of intellectual disability, because of the people who have intellectual disability, because of their limited ability to cope with stress or problem solve complex social situations, they are actually more likely to develop specific mental illness problems or psychiatric disorders such as depression and anxiety disorder.
Right. So you've already covered part of this in your previous answer, but I just wanted to ask, a popular myth or interpretation of the deficits in adaptive behavior among lawyers or legal communities that it might lead the judge to believe that these people constitute a threat to society or that they need to be segregated. How do you think capital defense lawyers should mitigate this issue?
So the popular myth and problems around interpreting deficits adaptive behavior, again, one misconception or one myth is that people with intellectual disability are not able to do anything. And that is a really critical myth or misconception to overcome. People with intellectual disability, especially people who have what we would think of as more milder forms of deficits of intellectual functioning and adaptive behavior, again, they have a very serious condition of intellectual disability, but they can learn, and with the right supports, with the right help of benefactors in their community, or with the right amount of repetition and structure, they can learn to live very successful lives. They can learn to live relatively independently, get jobs that may have maybe a lower complexity level in terms of tasks. And so they may sometimes appear to have a lot of strengths, and that's not incompatible, or that does not negate a diagnosis of intellectual disability. So they may be able to present certain strengths or assets. And again, that's because people with intellectual disability can learn things, can, with the right, context, can have stable social relationships. And so judges and lawyers often misinterpret some of these strengths and assets as a confounding situation. And so, the way we learn, the way everybody learns, is by observing other people, right? We don't have to make a mistake to learn from a mistake. We can see somebody else do it. And that's why it's important when we think about segregation and integration. That's why it's important in most countries. We have really moved away from segregating people who have intellectual disability to including them in the community, including them in society, because they can learn from everybody else and they can learn to become productive members of our society in general.
Thank you, Professor Tassé. So I just want to take off from what you mentioned about, with support, they can hold jobs and they can have stable social relationships. So I've we've observed how there is a lot of focus on presence of strengths, like just the ones that you just mentioned. And in these cases, when we present this at the court, it's often seen as not being grave enough to mitigate death. I believe even Nagendran Thermalingam, who was recently executed by the Singaporean government, had mild intellectual disability. And this is where I think it's important that a capital defense lawyer is presenting a whole picture of intellectual disability, not just as a clinical category. So I have two questions here. Why is it difficult for persons with intellectual disability who may have mild or moderate support needs to be diagnosed? And secondly, could you tell us more about why a life history approach is important in cases involving intellectual disability?
Let me attack the first question. So a person may have mild or moderate severity of intellectual disability and may be functioning well because of the supports that are in place. And that's why it's important to diagnose those conditions so that we can provide supports and services to those individuals. And when we provide the right amount of supports and services to individuals with intellectual disability, well, they generally will function better. They generally will learn more things. They will adapt better. They will find jobs and stay in their jobs when the supports and services are correct and are well placed. If we then say, well, that person's doing well, maybe they don't have, a misconception might be, well, maybe they don't have intellectual disability, and we can take that away. Well, then the person will regress. The person will start functioning poorly. So it's important to identify who has this condition of intellectual disability so we can then identify where are their strengths, where are their limitations, and put in place supports. And when the person does well, does better, that doesn't mean that they don't have the condition. It just means that what we're putting in place, what we're layering in, are correct, are effective, are meeting the needs of this person's support needs. And we need to continue doing that. And so that's important. And that's why it's important to identify and diagnose people with intellectual disability, is so that we can help support them. Because if we don't provide the right supports, then their functioning will regress, will not progress. And that's, I think, to everybody's betterment. So life history, understanding family history is important because it can give us information about environment, what environment this person grew up in, what setting, what context, because we know that there are a multitude of risk factors that can explain intellectual disability, and it's not always genetic. So it could be genetic, and then we may look at life history and family history and see if there's other individuals in the family who may have similar hereditary conditions. But sometimes the risk factors are multiple and are interacting. And so we need to understand that by looking at, did the person grow up in an abusive household, which can be an important risk factor? Did they grow up in an environment or a context that may have had, a farming area where they may have used pesticides or herbicides or they may have been exposed to other teratogens, which then affects brain development in young children? Were they in an environment or a household where they received stimulation, adequate stimulation to develop and learn and develop their academic skills? So looking at all of these, the family history and the life history of the person is really critical in identifying or giving us leads around what may have been the risk factors or the causes, and then help us really understand a better clinical picture, and then also may lead to how we can better intervene or mitigate the person's intellectual disability in their everyday context, whether that's school, work, or play in the community.
Right. So you've already told us how intellectual disability cannot be treated. But I just wanted to understand if you could tell us a little bit more about how people in prison with intellectual disabilities should be supported.
Yes, well, that's a good comment. I just want to make sure that I'm not misstating what I want to say. But when I say that intellectual disability cannot be treated, what I mean is the condition itself. So it's a lifelong condition. Now, people who have that condition, intellectual disability, because of the nature of the intellectual impairments and their resulting limitations in learning and in coping with stress, we know that there are certain broad approaches that lend themselves better to good outcome, to better supporting individuals with intellectual disability. So, for example, in a correctional setting or in a prison setting, people with intellectual disability uh, are often more likely to be victimized or taken advantage of by other prisoners or inmates who don't have an intellectual disability. So, making sure that we are vigilant around that so that they don't get exploited. People with intellectual disability do much better with structure, with predictability. So, being in an environment that has a lot of routines, a lot of predictable structure, known expectations, people with intellectual disability will do much better in those settings. Being able to have repetition where they can learn things and then know that if A happens, then B happens, and then C is what normally would happen next. So those are some broad strokes of things that help people with intellectual disability function better in a setting, whether it's an incarcerated setting, a prison setting, or other. Really can lead to better outcomes in terms of their behavior and their mental health as well.
Thank you, Professor Tassé. That brings us to the end of this podcast. Thank you so much for taking out the time to do this.
Well, thank you. Thank you for inviting me. This is a really important area to be talking about.